Have you heard of PEP before, or have you ever found yourself in situations that may require you to take PEP, or are you doing these tasks that predispose you to needing PEP in the near future? Or are you just curious to know about what PEP is all about and things of that sort? Yeah, if you're that person, this video is for you. So, in this video, I share something which I've experienced. Yeah, unlike the previous days where I used to fear PEP, I used to hold a lot of fears, which I'll share with you. Recently, I got myself in a scenario where I actually needed to take PEP, and I took it successfully. So they thought this could be helpful to someone else who is in my shoes previously, the way I was before, yeah, who would want to learn a thing or two about it. So PEP, talking about PEP, what is PEP? So PEP is an acronym for post-exposure prophylaxis. That may sound, in other words, it's post-exposure, like that medication taken after you've been exposed, to potential, in this case, HIV infected blood. Yeah, so there is a provision whereby of course, if you are at risk of exposure, there's a medication for that. Then if after exposure still there's medication or some drugs given to make sure that you don't acquire the disease, yeah, even when you've been exposed. So in this case, I'm talking about the one you take after you've been exposed. So that's PEP, and it's basically it's an emergency drug, and by emergency I mean it has to be taken as soon as possible. Usually for PEP, it's taken within 72 hours post exposure. After that, it doesn't work. So it's an emergency drug initiated within those first 72 hours after exposure and taken over a period of 28 days. Yeah. And it's basically antiretroviral drugs. Yeah. Taken, for it's not a lifetime medication, rather for 1 month or 28 days. Yeah. So, and usually there are a lot of, we have a lot of things we may be holding opinions about it. Personally, I remember before taking it, one of the fears I held is PEP should be it's a very big drug, something of that sort. Very big drug, and I used to fear it. Uh, I would say at this point, yes, it's big compared to the usual drugs which are common in our it's bigger than cetirizine, these smaller drugs we use for flu. It's yes, yeah, but it's not as big as my mind had, perceived it to be. It's that size that you will feel while you swallow. You perceive it, but it's actually not scaringly big. Yeah. Then the other fear I held was that it will give me side effects. Like they used to tell me, I have got a lot of colleagues who used to tell me, usually when you take PEP, it has a lot of side effects. You get there's something they call visual hallucinations. Yeah, in other words, you start seeing strange things, pink elephants, things of that sort. And I realized that that's actually not true with the current regimens. Like I checked the the current regimens. There's a component, there's a component that used to give those things back in the days in the first regiment, but the latest regiment, the latest type does not contain that particular drug that used to cause those things. I don't know if you get me. Like this PEP is an anti-HIV medication, but usually it has a combination of multiple drugs. Yeah, they get like 3 drugs and put them together into one tablet. You get. So usually in the previous times, the first drugs that were manufactured, there used to be one of the drugs that used to cause those things. But lately, the drugs being used, they don't have it. It was called efavirenz. It that is no longer included. It's different. It's a different combination now being used, which doesn't give those things. In other words, I actually took all my 28 days and I didn't see any side effect. Even the common side effects where people say maybe you get nausea, you feel like vomiting all the time. What? Actually didn't experience anything. Of course, we are different. Our bodies are different. For some people, these things will come up, but I surely didn't experience anything. It may be also sometimes we've heard that most of these people will give you like sleep disturbances. Yeah, that may be true. fortunately or unfortunately for me, I didn't realize, because that was the time when I used to do a lot of night duties. And I mean, if it's giving me insomnia, that's to my advantage. I like to keep awake, and I hope I'm awake and alert. Because there's also being awake when you're not alert, yeah. But that didn't affect me. For another person, it might actually affect them, yeah. So basically, that fear about the many side effects, personally, I didn't experience that. Then the other fear I had was that there are multiple drugs. Yeah, I used to think they are like you take like 3 pills, and then I realized it's actually 1 pill. Yeah, it's actually 1 pill. So basically, those are the ones. Yeah, maybe to tell you a little bit how did I find myself in that kind of position. Yeah, so it was this random night, a random work day, just like most of the work days. Yeah, we're working. It's 2 a.m. in the night. We are operating on multiple patients that would come in at hospital, and of course were in obs gyne department as delivering the mothers that need to be delivered. So we're doing this cesarean section, and 2 a.m. in the night, you're a bit tired. So we are doing, and of course before starting to work on a particular person, usually they tell you, like, details about them. And this particular patient we're working on at that point had told us that she was actually HIV positive, and we're aware and we're trying to be careful. Yeah. So we are moving on. In fact, the cesarean section moved on very well until the last minute. In fact, it was the last needle. Yeah, it was the last needle. So I was trying to close. This needle bounces off the instrument and pricks me, like around here. It pricked me. Good enough for completing, so I just completed quickly. I let my assistant continue with the other things that we had to finish up the procedure. Yeah, and I had to remove the glove. I realized I was actually bleeding at that point. Yeah, of course, just like any other person, my heart raced a bit, but I knew about PEP. Yeah, I knew about PEP, and I knew I would take it, and things would get better. I mean, this is an occupational hazard sort of. So I move glove again. Then we complete the procedure. We make sure that mother is out of theater. Then after that, I go down immediately, get the prescription. Yeah. What helped me was I was in a hospital environment, so definitely I would approach the pharmacy quickly. So I move down, get the prescription made, move to the pharmacy. I get the drugs. Um, Out of like, because I was a bit scared, I almost took the first drug immediately. But remember, this is anyway. By the time all those events ran, it was now getting to like 3 a.m. So for me, usually for the sake of discipline, I like to set a particular time. Like if I've taken at maybe, because this is a single, you take it once every day. I wanted to set a particular hour. For example, if it's 7 a.m., I'll do 7 a.m. throughout for all the 28 days, not keeping changing, because that can affect the discipline. I feel order helps, like to make sure that your discipline goes on. So at that point, I almost took, and then I realized, shall I keep on with the 3 a.m. thing? Most of us at 3 a.m. we are asleep. So I had to wait. After all, we said PEP should be started within the initial 72 hours. I was about like 45 minutes post exposure. I was too scared. Yeah, no wonder I moved this fast. So I knew I would push on some few hours to make it 7 a.m. because I'm sure every day at 7 a.m. I'm awake. It's either from a night duty I'm still awake, not yet sleeping, or preparing for day duty where I'll have to wake up early. And so 7 a.m. was a neutral time. Yeah. So that's how I moved, waited 7 a.m., took the first pill, and I waited for side effects, nothing happened. Moved second day, 7 a.m. I had to also put an alarm in my phone to remind me every time when it's 7. You see, that's how we create discipline. Yeah. If you're on this long-term medication, yeah, this I need to pitch in this. If you're on any long-term medication, you're struggling with discipline, taking this particular drug, taking this particular pill, that is one of the things. Setting a particular set time, like not changing all the time, and then setting an alarm, a reminder every time that time reaches, you take. So I had to take every 7 a.m. every day. And then the other thing that I did to make sure that I keep my discipline, Even if in my bag I divided these pills. Yeah, they gave me 30. I needed 28. I'll show you one of them. Yeah, I have it here. So I divided. So this is the one. Yeah, it's not so big. I hope the camera can see. This is TLD. Yeah, they are the three components of the drugs there. Yeah. So what did I do? I divided the. This was one of the two that remained. Yeah. Yeah. So I divided these bills 14 for 14. Then I had to leave some in my room and then would carry some, such that if I'm ever caught in a place where I'm not at home, I can still take. And then I always had a bottle of water with me. Yeah, so that's what helped me also with discipline, because I'm always in my bag. So that would be also a tip for someone else struggling with keeping up with this chronic medication. Yeah. So that's how I did. I moved. Of course, along the way, I would feel lazy some days, but still I had to take, because this is something serious. Yeah. Usually, PEP is only effective if you take it religiously every day for the 28 days without missing. So that's why you may not need to joke around with it or create excuses for whatever reason. You just have to be serious with it. So I took it, and then after the 28 days, the journey was done. But the journey is only complete when you test and you're negative. Yeah. So what is the ideal time? This could be to your information. What would be the ideal time for testing? Yeah. Post exposure. Usually it's advisable, though for me I didn't do it, it's advisable that before starting the regimen you test to make sure you're not positive in the first place, because you may be thinking it's this needle prick or it's that encounter with that person, yet you are already infected. Yeah. So it's advisable, check first. If you confirm you're negative, start the PEP, take it for the 28 days. If you feel like testing after the 4 weeks of those 4 weeks of taking, it's okay. But it's not of any meaning. It's just treating your psychology. Rather, the best time to check is 3 months post exposure, because there we assume, like, even if it were usually this virus, it doesn't form like those. When we are testing, we test for something we call antibodies. They're like the soldiers that respond to the HIV in blood. So those initial days, like those soldiers in the body are not yet well recruited, do not fight. So you may not really get anything meaningful. But after 3 months, we are sure there's something called seroconversion. Like we formed the antibodies. If they are there, you'll see them. So that's like, yeah. So I'm waiting for the because that was like 2 months ago. I'm waiting for 3 months so that I can test again. But since I was religious with my medication, I'm sure like there is no fear. I would only be scared if I missed or if I mismanaged it or something of that sort. So basically, that is it about the PEP. And someone would wonder, this is not magic, just just to give you a brief way how it actually works as we conclude. Yeah. Usually for HIV, like in this case, I'm using HIV because the PEP I took was for that. When it's introduced in your body, either it's a needle prick or it's through sexual intercourse or blood transfusion, whatever. For blood transfusion, things move so fast. There are 90% chances that you'll get infected. Though it's rare that you'll have infected blood being used for transfusion or given to patients in blood. It's rare. Usually it's tested fully, it's screened fully, and you make sure that it's safe. Rather now, these other modes, usually when you get a prick, for example, or if it's through sexual intercourse, that virus hides somewhere, under your skin. And then, of course, the body starts bringing some soldiers to fight it here and there. And those soldiers are the ones which carry it and take it to, there's something we call lymph nodes. Like in your body, these are also stores for more soldiers, yeah, to continue fighting. So the body assumes the body is trying as much as possible to help, yeah. So that the more, unfortunately, they help them to move even further. So when there are those lymph nodes, the moment they get there, there's a way because the virus is also not sleeping, it's finding a way to dominate as much as it can. So there is a way to create its DNA quickly, and then that DNA, it binds it with your own personal DNA, like your body's DNA. The virus gets DNA, binds it with yours. Now, as your body is producing more of your DNA, this virus has, mixed itself up with your personal DNA. So instead, the body goes on, like the body is always producing new cells, new what, we are always growing. So as the body is growing, even the virus is growing. That's how it multiplies, and time comes when the virus is too much in our system, because it put its DNA in our DNA, and now the body became the machine that produces the virus instead. So what the PEP does, it first of all makes sure that even if the virus has been put into your body, during those first initial, once you start it early, it makes sure that one, the virus doesn't form DNA, because in the natural state of a virus, it doesn't have a DNA. It just has something else similar to DNA, but it doesn't have DNA. So the PEP makes sure it doesn't form its DNA. Then those are the drugs that are in the PEP. Yeah, so one of them, because there are three drugs there. One of them makes sure it doesn't form the DNA. Another makes sure that even if it had formed some little DNA, it can't mix up with your personal DNA. Okay, so that's how the PEP works, basically. I don't want to go into too much science. So basically, that's how it works, and yeah, that's how it helps us from getting infected. Of course, once we're infected, still it makes sure that it does the same things, because we say these are anti-HIV medications. Just that PEP is a short course, while the one which is to treat HIV is lifetime course. Yeah? So even in the other, it makes sure that it doesn't over multiply. And that's how we do what? We keep the viral load down, and things of that sort. So basically, that's PEP. If this person, you've been exposed, there's still hope. Never take it for a joke. Usually, you don't want it to convert into something lifetime, something which you'd have solved. Yeah, in this, like taking advantage of that initial time you get. Yeah? So basically, that is it about PEP. I hope at this point, if you had any fears, I hope now you know the truth about PEP. I hope you also know how it works and how serious it should be taken. And once you take it, you know when to confirm that you're actually out of danger. Yeah, so basically, that is it. I hope you find this video helpful. Don't forget to subscribe to the channel. Yeah, it helps that you keep getting updates of such videos every time they come up.